We seem to have a problem with live stream. Doesn't matter. I will now start the webinar if you're all ready and let people in. Good morning, good afternoon, good evening to everyone. We welcome you, particularly those of you joining from far away or at late or at very early times. Welcome to today's EPI-WIN. As you know, today we have a very exciting topic. We'll be talking about the new phase of pandemic preparedness, which is an expert consultation for the report of the Global Pandemic Monitoring Board, the 2025 report. So we look forward to your contributions. It's great to have you with us. Just before I hand over for the opening remarks, I'd like to remind you that this webinar is being recorded. We'd love to hear from you. Many of you are old EPI-WIN followers, and you know the drill. We'd love to hear where you come from and what you do. Please introduce yourself on the chat. But for questions, we'd like you to write your questions in the Q&A box, not the chat. That's so that we can keep track of it. And please share your insights, your comments, anything you'd like, but keep it respectful, please, and constructive. We're here to learn, we're here to share from each other. So please, everything is positive and constructive and respectful. So without any further ado, now I'd like to invite Dr. Matthew Stone, who's a GPMB member and former Deputy Director General of WOA, to give the opening remarks. Over to you, Dr. Matthew.
Thank you, Dr. Sabria, and greetings from New Zealand. Welcome to you all around the world. Thank you to WHO on behalf of the Global Preparedness Monitoring Board for organising this consultation. And thank you too to our expert panelists who will be sharing their thoughts on the topic of the impacts of health emergencies. The Global Preparedness Monitoring Board, or GPMB, has been releasing reports since 2018, annual reports. And since 2022, our focus has been on developing a multi-sectoral collaboration for preparedness based on a monitoring framework that we've developed. It's a complex framework. It has close to 100 indicators, but it's in three major parts. The first part deals with risk and addresses the STEEP framework, that is the social, technical, economic, ecological, political risks. We have indicators across that framework. The second part deals with prevention, preparedness, and resilience, where we look at different systems. We look at people and communities, we look at financing and governance. And then the third part, where we look at the impact of health emergencies, the frequency and magnitude and cost, the health, economic and social and political impact, access to countermeasures, and the speed and equity of recovery. So this monitoring framework we've been using it for the last 3 years to frame our annual reports. And a second very important part of our methodology, once we've derived evidence in accordance with this indicator framework, is our consultation process. We've been engaging groups of experts to help us to shape up the findings and recommendations of our reports. And that process has been very informative. And I really, again, on behalf of GPMB, thank the expert panelists who are willing to share their views and help us to formulate our recommendations. With that, I'm not going to take up any more of our precious time. We only have 1 hour for this meeting. So looking forward to the discussion and the contributions. And again, welcome to all the participants listening in.
Thank you so much, Dr. Matthew Stone. Thank you for joining us from as far away as New Zealand today. I now hand over to Dr. Sylvie Priand, who's the head of the GPMB Secretariat. I invite her to give an overview of GPMB, the context to this webinar, and to introduce the panelists, our very exciting group of speakers that will talk to us today. So over to you, Sylvie, the floor is yours.
Thank you very much, Supriya, and thank you, Dr. Stone, for these welcoming remarks. So I would like to add also my welcome to all of you to this joint GPMB EPI-WIN webinar. Just a few words about the GPMB. So the GPMB is an independent monitoring and accountability body to ensure preparedness for global health crisis. It is co-convened by WHO, the World Health Organization, and the World Bank, and it was established in 2018 following the Ebola epidemic in West Africa. So I would like to take the opportunity to thank the co-chair of GPMB, Dr. Kolinda Grabar-Kitarovic, who is the former president of Croatia, and Dr. Joy Pumasi, former Minister of Health of Botswana, as well as all the members of the GPMB, including Dr. Stone, for their commitment to make the world a safer place. So as you know, COVID-19 has had a profound impact on all of us, on the economies, on the societies, on health, of course, as well. And it has affected all of us, all regions, all countries, and all age groups. But even if everyone suffered from COVID, the impact of the pandemic has been variable in different settings and contexts. And this at global level has made the collaboration between countries more challenging. But as you know, last week, this is a good news, the Intergovernmental Negotiating Body, or INB, agreed on the text of the pandemic treaty, which will be the basis for the discussion at the World Health Assembly later in May this year. This is a fantastic achievement of the 194 WHO member states because it will provide a new framework for international collaboration for the next global health crisis and help also to mitigate the impact of pandemics in the future. So the GPMB and the EPI-WIN team joined forces to host this webinar on the new phase of pandemic preparedness to take stock of what we learned during and after the COVID-19 pandemic and how the world can prevent and prepare for the next catastrophic event. So we invited very high-level senior officials from different countries to share their insights on the new phase of pandemic preparedness. And we are honored and very grateful that these distinguished speakers accepted this invitation. Today, we have senior leaders from Singapore, Japan, Thailand, and also a representative of the Western Pacific Regional Office of the WHO in the Philippines. We asked them the following questions. What are the top lessons learned from the COVID-19 pandemic in your country or region? And how has the experience of COVID-19 modified or will modify preparedness efforts in your country or region? So let's start this interesting discussion. And I would like to start with Professor Vernon Lee. Professor Lee is the Chief Executive Officer of the Communicable Disease Agency, CDA of Singapore. He's a public health physician with global experience. He has worked with WHO a few years ago and led the pandemic planning and outbreak response. And he developed Singapore's health strategies. He holds multiple advanced degrees and has published around 200 scientific papers and serves as an educator and international advisor in many committees. And we worked together in 2019 in a Lancet Commission on pandemic preparedness. Unfortunately, this commission did not finalize the work as COVID-19 struck in 2020. So I would like to give the floor to Professor Lee. Over to you. Thank you very much.
Thank you so much, Sylvie, and thank you to our WHO colleagues for the kind invitation to this meeting. So I'll just take us through some of Singapore's thinking about how we develop Singapore's pandemic resilience and also preparing for the future. Next slide. So like many other countries in the wake of the COVID-19 pandemic, Singapore looked at the things that we had done during the pandemic and did what we call an after-action review. It was a white paper that was presented in Parliament. And what we did was not so much to look back at the things that we had done or not done with 2020 hindsight, but to look at how we can actually build back stronger and better. So there were multiple recommendations when we did the review. And a few of those recommendations includes the need to strengthen resilience, both building up better surveillance systems regionally and globally, supply chain and healthcare system capacity to guard against shocks and disruptions. We needed to have a dynamic but yet flexible pandemic preparedness and response strategy, where previous response strategies tended to be more hardwired and in a sort of a stepwise fashion. During the COVID-19 pandemic, we realized that the pandemic created a lot of different sort of situations that we had to deal with. And there were also cycles where the number of cases also waxes and wanes, so we had to deal with. And finally, to enable consolidation of the public health expertise and organizational capacity, we wanted to form a new agency where we could have direct command, control, and coordination of everything to do with infectious diseases and health security issues. So that led to the formation of the Communicable Diseases Agency to promote this more agile and coordinated response to emerging infectious diseases. And the agency was just formed on 1st of April this year, so we are barely 3 weeks old, but a lot of the work had started 2 years ago when this white paper was released. Next slide. So the agency's approach to disease threats is an integrated one to prepare, prevent, and protect against any infectious diseases threats that Singapore might face. And we do this through 5 different sort of pillars. One is, of course, global engagements, which is extremely important, both regional engagements and global engagements, so that we can partner to make the world a safer place against infectious disease threats. The other is having good policy and operational constructs and foundations, because the strong policy sort of dimension in dealing with infectious disease is important so that we can actually roll out response operations when we need it most. The other is research to influence those policies and operations. So everything that we do here is based on solid evidence. And if we don't yet have the evidence, we'll do research to find that evidence. Of course, outbreak management and control for endemic diseases. And of course, if a pandemic should occur, we'll be able to respond quickly. And finally, the whole of government coordination and approach. Next slide. So some of the things that we have done, we have reviewed our Infectious Diseases Act, which is a piece of legislation in Singapore that protects us against infectious diseases. Previously, a lot of the scenarios were basically just peacetime, or we have to then flip towards a health emergency. And our previous approach to dealing with disease outbreaks was also very much in a stepwise fashion, as shown in the bottom left hand graph, where we move to the different color codes in a very much a stepwise fashion. But as we learned during COVID, pandemics do not occur in a stepwise fashion, and we can actually swing from sort of responses to periods of relative calm and then another wave and so on and so forth. So in our new scenarios, we just have come up with 4 different scenarios: a baseline scenario, outbreak management, public health threat, and also public health emergency scenarios, where we can activate if we need to unlock certain legal provisions. And we can move from any of these scenarios at any point in time, so they're not hardwired in a stepwise fashion. Next slide. The other thing that we've also done in our pandemic preparedness and response plan is a plug-and-play approach. So not to hardwire ourselves again to any set of measures. As we realized during COVID, there were certain measures that we had never planned for. And there were measures that we had planned for other respiratory disease pandemics, but that were not activated in the sort of a framework that we thought we might use it. So the plug-and-play approach basically is a flexible modular approach in which we are prepared to launch different modules, but depending on the actual disease situation, we can pick and choose which modules to actually activate. And this provides us with a more flexible approach to deal with the actual pandemic should it occur. Next. We have also strengthened our supply chains and increased our healthcare system capacities, diversifying, for example, our supply chains, building up local production capabilities for supplies, training a healthcare reserve workforce to provide surge capacity, which is extremely important during a pandemic, especially when the healthcare system is under strain. And also building and sustaining medical resources, facilities, logistics to support all of the public health measures. And of course, strengthening our healthcare institutions, preparedness and readiness, business continuity planning, and so on. So this will enable our entire healthcare system to be a lot more resilient in the face of future pandemics, especially one that has multiple waves. Next slide. And finally, the health sector cannot go on this alone. We had to build up an entire public health ecosystem. So the Communicable Diseases Agency will partner with, of course, the Ministry of Health, as we had an umbrella organization under the broader ministry's remit. We'll also partner with healthcare providers, both public and private healthcare institutions that provide a lot of support and surge capacity during the pandemic. Of course, working with the National Center for Infectious Diseases, which is our infectious disease clinical hospital, and also with all of our One Health agencies and with the broader whole of government ecosystem, and also all of society, civil society, academic institutions, and other community partners to ensure that everyone has a part and a role to play in pandemic preparedness and response, such that if a crisis should occur again in the future, we'll be better prepared to detect it, to prevent its introduction as far as possible, but if not, we'll be able to respond swiftly to prevent severe impact to Singapore and our society. Thank you so much.
Thank you so much, Professor Lee. And I will now move to Dr. Tomoya Saito from Japan. So he is director for the Center for Emergency Preparedness and Response at Japan's National Institute of Infectious Disease within the Japan Institute for Health Security. Professor Dr. Tomoya Saito is a leading expert in public health emergencies, and he has advised Japan's COVID-19 response, as well as the Tokyo 2020 Olympics and the WHO Review Committee on International Health Regulation. He has previously worked as well on crises like Fukushima and Ebola at the Japan Ministries of Health. So I would like to give you the floor, Dr. Saito. Thank you very much for being with us today.
Okay, Sabri, thank you very much for the introduction, and hello everyone from all over the world. I'm Tomoya from Japan Institute for Health Security, which was just established this April, merging two institutes, National Institute of Infectious Diseases, which have the surveillance and laboratory capacity, and the National Center for Global Health and Medicine, which have the General Hospital Clinical Services and Clinical Research function. And I've been working on public health emergency preparedness, especially pandemic preparedness, last 15 years. So first, I have to summarize the 3 lessons learned, but it's quite difficult because, the COVID-19 was kind of a stress test to the public health for the whole of the society. And COVID-19 revealed many weaknesses or vulnerabilities. But first of all, I'd like to point out that the problems of overfitting of plans to the previous pandemic. So the lesson is we should not optimize the plan for the previous pandemic. We learned from the 2009 pandemic again and again, and our plans and actions are perhaps unknowingly optimized for influenza, particularly past cases like H1N1 or H7N9. So we had not been forward-looking approach. So we now were learning from COVID-19, and we are focusing on issues we could not complete in COVID-19, but we should not fit or optimize our next plan for the COVID-19. So we do need a proper horizon scanning of the future threat and risk. That is very important. And second is the communication. In the early stage of the outbreak, scientists had to brief decision makers on the situation and describe where this still invisible threat is going to be. And mathematical modeling yielded valuable insights, yet translating those analyses and forecasts when risks not yet visible into persuasive advice and actionable policy was extraordinarily difficult. On sparse data, convincing leaders of the need for tighter border controls or social distancing measures was a major challenge. So strengthening this science to policy translation capacity is therefore essential. And communication with the public was even more crucial. And Japan did have the act for the social distancing orders, but their binding power was very weak. The broad compliance depended on citizens' voluntary cooperation. So therefore, risk communication and community engagement activities are important. However, these have long been under-resourced in both staffing and funding. So therefore, we must build communication strategies and plans with clear objectives and invest in staffing and resources needed to deliver them from the peacetime. And third is the emergency operation capacities. In the area of infectious disease control, we prioritize the capacity building for the technical issues like laboratory or the epidemiologies. But these are still important, but we recognize, we rarely discuss the capacity for large-scale operations and logistics. So the medical supplies, procurement of vaccines, mass vaccination, or sales capacity for medical services, it's a quite different scale of the unexpected, enormous, huge scale of the logistics. So fortunately, in our country, we have the DMAT, Disaster Medical Assistance Team. And in the early phase of the outbreak, we have the cruise ship outbreak in the Diamond Princess. And we have a cluster of more than 700 cases at a time. And we have to transport to the many hospitals and isolate them. So with that operation, we did need the DMAT, that's the power of DMAT. So that preparedness for the natural disasters works for other types of the health security event. So building a scalable and flexible system for event management and logistics is a critical important challenge. And I believe it can become a vital capacity for health security, not only in the case of pandemic, but also in other situations. So next, I'd like to talk about how they change, how our pandemic plans has changed. The first is about, it's same as Singapore, but the legal preparedness and planning. We amended the law, the act for the Special Measures Act for Pandemic Preparedness and Planning. The act primarily focused on the novel influenza pandemic, but now it broadened its scope beyond the novel influenza. So at the early time of the COVID-19 outbreak, this Special Measures Act could not cover the SARS-CoV-2. So it amended and also now amended to cover the other potential pandemic pathogens. So now we can implement such kind of pathogens right now. And also, the other thing is that we have the plans should be flexible and agile and adaptable. So we have a lot of issues we could not well respond under the pandemic influenza plan. So whatever the disease is and what type of impact to the society, we have to be flexible and mitigate the impact. So our approach is a kind of menu book approach, or the plan is a flexible toolkit that offers tailored strategies for the pandemic preparedness. And that is maybe similar to plug and play approach in Singapore, but we can pick up and choose necessary action options from the menu book from this action plan, and they can implement to adapt to the ongoing outbreak. And also, we amended this government action plan last year, and we fully revised the issues raised during COVID-19. For example, the MCM, medical countermeasures, R&D and supply, and surveillance, risk communication, border measures, or surge capacity for medical services. We enhanced the descriptions. And medical MCM R&D was the major point of the revision. So to develop and supply the new MCMs, we have to start early as possible when some disease emerges. And also, we have to work closely with the surveillance or laboratory diagnostics or animal studies or human studies. So therefore, we merged the NIID and NCGM to establish Japan Institute for Health Security. Now we have a very seamless and streamlined R&D capacity. And also, Japan established a prioritized disease list for pathogen X, and also now investing for the vaccine development and also for the production capacities or for the surge capacity. And last but not least, the human resource development is very important, especially, as I said, in the disease control field, we've primarily focused on the technical resources like laboratory scientists and epidemiologists, but we recognize the importance, the need for the strong leadership and management skills in coordinating responses. So that kind of resources should be not only in the national level, but also at the local level. So such leadership is quite important. So we just started such the leadership education program recently. So that's all from me. Thank you very much for this opportunity.
Thank you very much, Dr. Saito. It was really very interesting to see the experience of Japan, which has some similarities with Singapore, but still something very special as well, given the way the pandemic has impacted you, as you rightly said, with the Diamond Princess and the initial cases that came from the sea to Japan. So now I would like to give the floor to Dr. Viroj Pancharwan-Satien, who comes from Thailand. I will call him Viroj, Dr. Viroj, because first, his family name is a bit complex for me. And secondly, because I have the honor to know him for many years. He's not only a remarkable professional, but also a man of value, deeply dedicated to promoting equity. So Dr. Viroj is an advisor for the International Health Policy Program at the Thai Ministry of Public Health, but he also served as the INB Vice Chair, through which he has led the development of Article 12 of the Pandemic Agreement on Pathogen Access and Benefit Sharing System, the famous PABS. And maybe we'll have time to talk about it later in this conversation. But for the time being, Dr. Viroj, please tell us a little bit more about the Thai experience of the COVID-19 pandemic and the new preparedness there. Over to you. Thank you.
Thank you, Sylvie. Thank you, GPMB, for this invitation. Thailand is a middle-income country compared to Japan and Singapore. We have less resources. Therefore, my reflection is more or less on middle-income country perspective. What are the top three lessons learned? I think we have a small lesson on positive impact that we learn a lot how to better respond for the next phase or pandemic emergency. We have gone through IAR in intra action review. We have AR and UHPR pilot country, as well as the JEE was conducted in 2023. The outcome is much improved compared to the previous AR. So this is the first positive impact. So we have more negative impact, which is excess death, range between 25,000 to 40,000 excess death. And this disproportionately death impact on people living in vulnerable situation. These are older person, NCD, kidney disease, chronic CKD, person with disability for which they cannot cope with the situation well compared to non-person with disability. Also, the economic impact has disproportionately impact on the people in vulnerable situations, for example, job loss, unemployment, and homelessness. Importantly, we see proliferation of misinformation and disinformation, and the effective rebuttal mechanism is not that strong. That create vaccine hesitancy, and the vaccine hesitancy created also by anti-vax outside country, also inside country. So we see no effective rebuttal mechanism. And communication and coordination is lacking among local government and national government. One of the strength and enabling factor we learn from, we have a strong social network and social capitals. There's a community cohesion, especially in rural area. These are the external resources to boost the resilience, the community resilience, especially among the vulnerable population. We have a strong universal health coverage and primary health care. These are the two foundations for effective response. All citizens, Thai and non-Thai, had equal access to lab tests for confirmation of infection, treatment, care, including vaccine for everyone when we roll out the vaccine. We learned that agile and adaptive capacities, where decisions are based on epidemiological evidence, evolve according to different phases of pandemic, and maximize use of teleconsultation to safeguard essential services. We develop a scientific capacity to provide quick evidence on, for example, on immunogenicity from different vaccine platform they call vaccine mix and match. For example, inactivate platform protein subunit or viral vector or mRNA for the second dose or third dose of booster dose. We note that public trust ensure high adherence to public health and social measures that introduced by government. Similar finding in Japan and Singapore, that public trust to the government institution is so important to ensure that adherence to PHSM is there. We have more than 1 million village health volunteers. They provide indispensable contribution in supporting public health and social measures. They support surveillance and of cases and quarantine, and also advocate vaccine rollout. The second question on how has this experience of COVID modified and will modify our capacities? We have reviewed Infectious Disease Control Act. They are still valid, but the effective implementation was noted, and also action plan being revised and updated. We have a good information on the manufacturing capacity of PPE, of face masks, whatever PPE, except diagnostic that we also need to import. So that is our weakness in time of fake or public health emergency. The disruption of diagnostic is key. We have strengthened and planned and well impressed on integrate One Health surveillance, both case-based and event-based. We have expanded sentinel site of active surveillance in wildlife, domesticated animal and humans for potential zoonotic diseases. We have strengthened the technical capacity of the existing 8,000 surveillance and rapid response team nationwide. This 8,000 is at the sub-district level of a typical population of 5,000. So this 8,000 SRRT is so critical in surveillance and rapid response. We have further expanded FETP for One Health workforce for surveillance preparedness and collaboration among One Health partners, epidemiologists, and public health officers. We have sustained lab capacity on genome sequencing so that we can detect novel virus and share with the WHO in a timely manner. Also, we are considering replacing IHR focal point by a national IHR authority to improve multi-sectoral coordination within country. Over to you, Sylvie.
Thank you very much, Dr. Viroj. this experience in Thailand. And indeed, I mean, different countries have had different impacts and different vulnerabilities, and it's great to see how each country is trying to take into account its own context to further prepare for the next crisis. So let's move now to the regional level with Dr. Gina Saman. So thank you very much, Gina, for joining us. I will briefly introduce you. So Gina, you have been working with WHO for many years. You are, of course, a very important person now in the WHO the regional office in Manila, because you are the emergency director, so directly linking with countries for better preparedness. But also, I would like to highlight your previous work at WHO in headquarters on the pandemic influenza preparedness framework, where you led the implementation of this framework for many years, working, of course, on improving equity and putting in place access and benefit sharing systems for influenza, but also your work on the PRED, on the preparedness and resilience for emerging threats. This initiative, which was meant to also provide more guidance to countries, different types of countries, to increase their preparedness. So Gina, over to you for this regional perspective. Thank you very much.
Thank you, Sylvie. Wonderful to see you all, and greetings to all colleagues around the world. Let me tell you first of all about the Western Pacific region. It spans 27 countries, some very populous and some very low populations. There are some low-income countries and some very high-income countries. There are countries with mega cities, and there are countries that are small island developing states. You couldn't get more diverse than this region. But it's a very big day here for us at the regional office here in Manila. We have 2 workshops underway, and I just want to tell people a little bit about them, Sylvie. One of them is for alumni of our Regional Epidemiology Fellowship Program. These are alumni who come from 16 countries, and they're discussing the agility in regional systems and workforce based on the latest public health risks and priorities. This fellowship program has been running for nearly 20 years, and over 200 alumni from 18 countries, and they form the fabric of collaboration and cohesion in field epidemiology and public health in our region. That's the first workshop that's currently underway here in Manila. The second is a 10-country workshop on techniques for rapid behavioral science research in emergencies. This is attended by risk communicators, health promotion experts, and public health practitioners from 10 countries in our region. In this workshop, they're discussing the how-to for rapidly understanding community sentiments and knowledge relating to public health emergencies, risks, and public health interventions. Why am I telling you all this? It speaks to the key lesson, I think, from the pandemic. That is, preparedness works. Country preparedness, regional surge systems, regional solidarity, preparedness works. And these workshops that are hosted today here by the regional office are examples of what we do best. We are strengthening our preparedness. We do this in line with global norms and regulations, such as the international health regulations. We also do it in line with our regional frameworks, such as our Asia-Pacific Health Security Action Framework, APSAF. During the pandemic, we saw that these emergency systems, these surge networks, kicked into action, be it the Global Outbreak Alert and Response Network, GOAN, which has 80 partners across 17 countries in our region. Be it the emergency medical teams, there are 16, a third of the world's EMTs are in our region. They surged, they supported countries in vaccine deployment, in medical service delivery, and emergency care. Be it our IHR national focal points, who every year to year, practiced and came together in an exercise, we call it Exercise Crystal, and they came together to practice the systems, to coordinate, to communicate, to respond in line with the frameworks of the international health regulations. Be it our public health emergency operations centers, We have one in each of our 27 countries, and they serve as coordination points, public health excellence. And these really are important systems, country-level systems, that supported both national responses as well as cross-country surge support. So it's part of our need, and we're continuing this effort to have a ready-to-go workforce, a workforce that is multisectoral and interconnected. It's what is at the heart of the Global Health Emergency Core concept that's promoted by WHO, where our workforce is ready to respond to any issue of the day. So how has this modified our work in preparedness? How has COVID led to a new phase of pandemic preparedness? As Sylvie mentioned, we are looking now differently at how to prepare for pandemics. Dr. Tomoya actually mentioned this concept of elaborating from looking at just one pathogen to a whole range of pathogens. Dr. Vernon mentioned how we have to have a plug-and-play system. And this is really the new phase of pandemic preparedness technically. It enables us to then be able to manage a pathogen base, but it also means that we're more connected to the risks that we face every day, those induced by climate change, those occurring at the human-animal environment interface. And so that is one key aspect that we've learned and we're growing based on the COVID-19 response. The other is that we're boosting operational readiness regionally as well. And we heard from Dr. Tomoya, from Dr. Vernon, that countries are looking, and Dr. Viraj actually mentioned as well, operational systems, medical countermeasures, public health products, emergency products that are needed. Where are they? How can we make sure countries have access to them, timely access to them? And so boosting this approach, boosting operational readiness regionally, leveraging the region's incredible research and development capacity, our incredible manufacturing capacity, supply chain systems, the purchase power of the countries in our region. This means that we can now look ahead and focus on the practical and to address those bottlenecks that we learned from COVID-19 to be better ready operationally for the next one. Back to you, Sue.
Thank you very much, Tina, for this regional perspective, which is also very interesting and important. I think this is also part of the new way we see preparedness, because maybe before we were focusing a lot on national capacities, national aspects, but we have seen with COVID-19 that there is another dimension, which is the supranational one, especially for supply chain, access to vaccines and other medical countermeasures that cannot be dealt only with the national perspective. We need also to have international collaboration at regional level, but also beyond the region sometimes, because depending on where you live, some regions are closer than others to your country. So I think these are very important points as well. And to summarize a little bit what we have seen so far, because before going to Q&A, just to say that the speakers highlighted the need after the COVID-19 pandemic to formalize some kind of preparedness, either through national agencies or to the strengthening of existing mechanisms, but with a slightly different perspective. But all these attempts to formalize things are really based on strengthening the collaboration between different entities, because pandemics are complex phenomena that requires really a multi-sectoral collaboration. And this collaboration to exist needs also some legal and institutional space to be really fully effective. The second point that was highlighted really is the communication, not only the communication with the public and the community engagement, but also more communication between science and policy to ensure that the scientific findings are well translated into action. And also highlighting that this communication is essential to build trust, and trust is one of the most important commodity when we envisage response. We have seen as well that the research and development for a new medical countermeasure is very important. And even if it doesn't seem very new to many of you, it is some kind of new, because I remember during the 2009 influenza pandemic, research was not part of preparedness nor response. And so a lot of progress has been made since then. Of course, it's nearly 15 years now, so you may think that it's not very fast, but still, I think it's a major change in the way we envisage pandemics by including research within the response, but also research during inter-pandemic period, where we try to develop new measures for unknown pathogens or disease X. Another very important point that was mentioned by Thailand is this local response. And I was really impressed by the 8,000 rapid response teams that are deployed at local level, and understanding that, of course, the linkages between national and local response are really important and should be prepared as well. And finally, last, of course, but not least, really the training, I mean, the workforce, the people that we will need for the next pandemic, and what kind of skills are really essential for this approach. So I will, I've looked a little bit at the Q&A. We still have a few minutes to look at this. And maybe I will start with one question that was directed to Matt Stone on the avian flu. And it was, let me find it, but about really what are the recommendations. Sorry, I'm looking at, there is a long list of questions, 14. So, but Matt, it was about avian flu and really what can you advise for avian flu, especially given that the spread of H5N1 in many countries and many regions. And so if you have any advice for this, over to you.
Yeah, sure. Thanks, Sylvie. And I did just put a written response into the Q&A on this topic, but avian influenza is a hugely important issue. The question was, are there any, are we doing enough, essentially? And the big challenge is once these zoonotic agents get well established in animal populations, including in wildlife, then we have to accept that eradication is almost impossible. So we're reduced to strengthening our monitoring and early warning systems, detecting changes in the epidemiology, spread to new areas, and of course, spillover events, and reacting quickly to those. Of course, in my area, in the animal health and livestock husbandry area, introducing good biosecurity practices in our food systems, including vaccination to reduce exposure and prevalence, is something that we're working hard at, and that's part of the monitoring. The collaboration between WOA, FAO, and WHO in terms of surveillance and monitoring and the recommendations associated with vaccine strains, all under the auspices of the OFFLU collaboration. Very, very important work from our perspective. Thanks, Sylvie.
Sorry, thank you very much, Matt. And maybe there is also a question, very interesting question on the community level preparedness and so on. And Dr. Viraj has already spoken about it in middle income countries. And often we think that community engagement is really more for lower income countries, middle income countries. But so I would like to direct this question to Dr. Tomoya. In Japan, how do you address the issue of community engagement, and how do you see this in a country with a very, very developed health system? Over to you.
Yeah, thank you very much for the question. And we have often discussed about the cutting edge approach, but the basement of the pandemic preparedness is the it's the one of the culture, the sanitation or the sanitation or basic sanitation, or such as washing hands, wearing masks, or it's a kind of everyday business. So we do need a bottom-up approach, and the keys are all in the peacetime, and every day we face a lot of different infectious diseases, and we have to introduce vaccines or sanitary measures and health education, and we have a lot of opportunities to work on this process or education opportunities. So there's no shortcut or no easy path, but the keys are in the peacetime and everyday work. So there is a lot of political attention or political momentum in the pandemic preparedness still. So, but not invest on the cutting edge R&D, but also work on the everyday, infection control measures, invest infection control measures. That is very important. Yeah.
Thank you very much. And I would like, there was also some question about access to countermeasure, and Professor Lee, you know that Singapore is not producing vaccine, and it's a small country, and so even if you have the resources to access, I know that at the beginning of the pandemic, I mean, at least when vaccines were available, small countries had really difficulties to access vaccines because all the stocks were already bought by larger countries. And so how do you foresee the future regarding access to countermeasure in your country? Over to you.
Thanks so much, Sylvie. So I think access to countermeasures is not something that one country or single country can deal with. It's something that we have to collectively deal with at the global level. So after the pandemic, I'm quite pleased to see many different initiatives like CEPI, the 100 Days Mission, and so on, trying to come up with new technologies, whether it's vaccines, therapeutics, or otherwise, to combat novel diseases. But at the same time, the discovery of new countermeasures is one thing, but manufacturing sufficient quantities of them to be available in all countries is another step that we need to take. And this is where I think initiatives like regional vaccine manufacturing capacity initiatives and all that, I think those are very important, so that there is sufficient production capacity to develop or to produce these countermeasures during a pandemic. And it's important also that we have these facilities available during sort of peacetime, to be able to keep them warm, whether it's to produce countermeasures for other sort of endemic diseases and so on, so that the capacity is there ready to be activated during a pandemic. So I think this is something that we have to work together across the world to be prepared collectively. I don't think it's something that any single country can work on by itself. Thank you. Sylvie, I think you're muted. Yeah.
Sorry, thank you. Thank you very much, Rhiannon. So for the few minutes left, I would like to ask Dr. Viroj about misinformation, communication, and so on, because as you know, this has been an issue during the COVID-19 pandemic, but also during the negotiation of the pandemic agreement, because a lot of countries have seen that this treaty could be also undermining national sovereignty. So the issue of communication nowadays is really important, and at national level, but also at global level. And so what is your perspective on that, and how can we improve this for the next pandemic? Over to you.
I think WHO and many other international colleagues, the UN agency is the center point for fact check and verification and rebuttal information and evidence to be circulated to every countries affected, especially when there's a huge conspiracy theory behind COVID, and the mechanism is not that effective to counteract with all this anti-vax message, etc. I'd like to follow on Professor Venon comment on access to countermeasures. In the pandemic agreement, we have one major provision on expansion of manufacturing capacity into LMIC, as well as the negotiation towards a PEPs annex. It may take another year. So if we are lucky in 2026 that the PEPs annex was negotiated and concluded and was adopted by WHO in 2026, and then we take another year for ratification. So 2027 that the COP will start its work and up and running. So that is the best scenario. Over to you, Sylvie.
Thank you very much. Yes, and it's good to highlight that it's work in progress as well, and it's not yet done. I mean, but already I think the agreement on the document and the text is already a very important step forward. So there is a lot of hope in the future, even if, of course, we know that we will have another pandemic sometimes. I think the fact that today we have been together, we have discussed this, we have exchanged best practices, we have exchanged also insights and visions. I think this is a very also important discussion that we need to have to make sure that preparedness is still alive, and that we are not just forgetting what happened during COVID-19, because we know that pandemics are marked by a cycle of panic and neglect. So if we can reduce the effect of panic and neglect, I think it would be excellent. So with this, I will thank you all for what you have contributed today to this discussion. Thank you also to the audience and all the people who have commenting in the chat and the exchange of information. I think this is exactly the purpose of EPI-WIN, to be a platform for exchange, dialogue, and increasing our collective knowledge on very important topics. And I will give the floor now to my colleague Maya Kita from the GPMB Secretariat to give you more information on the GPMB and documents that you can find on our webpage. And thank you again to everyone. Over to you, Maya.
Thank you very much, Sylvie. Thank you very much, all of you, for attending this webinar. And thanks once again to the speakers and panelists for their wonderful discussions. We would like to let you know that a summary of today's webinar will be included as a technical annex of our next yearly GPMB report. And also, we would like to inform you that once the report is published, it will be online through our website. So please follow us also on social media. We will paste the links now in the chat. And thank you once again. And back to you, Supriya.
Thank you very much, well, to all the panelists, to Dr. Stone, to Professor Lee, to Dr. Firoj, to Gina, and Dr. Tomoya. Absolutely fantastic insights. Thanks to Maya for organizing, doing most of the work behind the scenes. But most of all, thank you to Sylvie for bringing all this together from a concept to actually having it together. In fact, I don't know if many of our attendees from EPI-WIN know, but it was Sylvie who originally had the idea of EPI-WIN. So she started it. And, you know, many years on, it's still going strong. So huge thank you to Sylvie. As Maya mentioned, this will be shared in the GPMB report annex. We will also share the recording and the presentations on the EPI-WIN website, which will be on the chat. And I just want to share with you the next few EPI-WIN webinars. Next week, we will have one on strengthening community health workers' capacity. On the 7th of May, we will focus on chikungunya, the Indian Ocean outbreak, but we will also talk about new ways of managing chikungunya. And most importantly, on the 14th of May, we will have part 2 of this consultation getting other perspectives from other regions. So please do join us there. And finally, thanks to everyone who attended. Without you, EPI-WIN wouldn't be EPI-WIN. So thank you very much. Bye.
Bye-bye.